In this lecture, we will discuss the ECG classification of ischemic heart disease. The EKG can be used to classify different stages of ischemic heart disease. Characteristic STT changes, QRS changes, and other features can help guide management of acute coronary syndrome. What we want to look at here is how we can classify ischemic heart disease with these changes. Let's start with stable coronary artery disease, which may be also referred to as stable angina pectoris. This does not result in STT changes at rest. However, if the oxygen demand of the heart is increased, such as with exercise stress test or any physical activity, ischemic STT changes would appear. So again, this is stable coronary artery disease. We call it stable angina. Okay, so no ST changes at rest. However, if you increase any activity, if they're climbing stairs, okay, now you're increasing the demand. And because of that increased demand, if we can't meet it with the more oxygen supply, we'll get these ischemic STT changes, okay, with that increase in demand. Now, if there are QRS changes present, such as pathological Q waves, fragmented QRS complexes, or a reduction in R wave amplitude, these likely suggest prior infarction, okay? And we'll talk about these QRS changes and how they resemble this prior MI in future lectures. Okay, so that is stable coronary artery disease. How about acute coronary syndrome, or ACS? Well, based on the EKG, we can classify it into ST elevation or non-ST elevation acute coronary syndrome. And this is important because it affects our management of the patient. So first, with ST elevation acute coronary syndrome, just as the name implies, this is acute coronary syndrome with elevated ST segments on the EKG. Nearly all cases develop into myocardial infarction and is why you'll hear the term STEMI used, okay, which stands for ST elevation myocardial infarction. And then there's non-ST elevation acute coronary syndrome. And just as the name implies, acute coronary syndrome without ST elevation on the EKG. Okay, so that's non-ST elevation ACS. If myocardial infarction does develop, then it's referred to as an NSTEMI, or non-ST elevation myocardial infarction. And if there's no myocardial infarction that develops, then it's referred to as unstable angina. Okay, so again, let's review what we discussed before we end here. So again, the EKG classification of ischemic heart disease, we're looking at stable coronary artery disease versus acute coronary syndrome. We mentioned stable coronary artery disease is when we have stable angina. In other words, the patient is asymptomatic, just walking around or just with minimal activity, and then all of a sudden they start to exert themselves even more. The oxygen demand increases. We can't meet that demand, and therefore they develop these ischemic symptoms at times. Okay, in those cases we'll see these ischemic STT changes. Okay, now if there are QRS changes, we'll talk about how those resemble and suggest a prior infarction. In terms of acute coronary syndrome, we said we can divide it into ST elevation acute coronary syndrome or non-ST elevation acute coronary syndrome. Okay, remember the only difference here is that either the ST elevation is present, okay, as the name implies, or it's absent, okay, non-ST elevation acute coronary syndrome. Okay, why these are important is because it affects management of the patient. Now, nearly all those that have these ST elevation ACS develop into MI, and that's what we call this STEMI. Okay, ST elevation myocardial infarction. In terms of non-ST elevation acute coronary syndrome, where there's no ST elevation, if it does develop into an MI, we call that an NSTEMI, okay? N for non-ST elevation MI, okay? Now, if there's no MI that develops, then we call this unstable angina, okay? Remember, stable angina was when we have no symptoms, then we exert ourselves, okay? And then we start to get these ischemic symptoms that come about, okay? And that occurs with stable coronary artery disease. Well, that's the end of this lecture. We discussed the EKG classification of ischemic heart disease. I hope you learned something.